Welcome to the New Jersey Vein and Vascular Center in Randolph, New Jersey. Today we are speaking with Dr. Miller, the founder and medical director of the New Jersey Vein and Vascular Center. He's here today to discuss the symptoms, diagnosis, and treatment of varicose veins.
Hi, Dr. Stuart Miller, New Jersey Vein and Vascular Center, 390 Route 10 West in Randolph, New Jersey. Patients often ask me exactly what is varicose vein disease. To understand that a little better, we have to understand the vascular system, with the heart pumping blood by way of the arteries to the body, and then the blood returning back to the heart by way of the veins. Varicose vein disease, in basic terms, is disease of the veins of the legs. And the veins of the legs contain valves which make sure that the flow flows back to the heart in one direction. And when varicose vein disease is present, the valves in the legs are broken, the blood can move in two directions, and it causes symptoms in the legs. Varicose vein disease has multiple causes. The most common cause is genetic. Other than that, it depends upon your lifestyle. Did you sit or stand a lot during your career? Did you have trauma to your legs? Did you have surgery? Prior surgery on your legs, most likely orthopedic surgery. When orthopedic surgery is performed, tourniquets are placed, which tends to damage all the valves in the veins, and in that fashion it does enhance the formation of varicose vein disease.
We asked Dr. Miller to share with us the most common symptoms he sees in patients with varicose veins.
Varicose vein disease is a disease which typically is not life-threatening, but it's lifestyle-altering. Patients often present with symptoms such as aching and pain. They've got heaviness in their legs. The legs are tired at the end of the day. Some patients can have swelling in their legs. They could also develop in end stages ulcerations with spontaneous bleeding. There's really quite a few different symptoms patients can present with varicose vein disease. The body tends to obey laws of physics like everything else in a natural system, and there's certain laws or principles that are present, such as Le Chatelier's principle, where in chemistry everything wants to find an equilibrium, and such is similar also for veins. Veins want to maintain a certain equilibrium of drainage of blood back to the heart, and when the veins are not functioning properly, the veins will actually start forming more veins to assist in the removal of blood back to the heart. And that is kind of what the crux of varicose vein disease is, how the body is basically trying to help alleviate a problem. Most patients do present with certain symptoms. Most patients tell me, my legs feel heavy, I've got weakness in my legs, I've got swelling by the end of the day, I've got aching in my legs, I've got restless legs at nighttime. So they're coming to you because they have symptoms which they are seeking relief for. Very frequently we do see patients presenting with clusters of veins or bulging veins, and the funny thing is, actually the word varicose comes from the Greek word meaning grapes, and in some instances they look like clusters of grapes on the legs, and that's just one symptom or way that the patient will present where they're seeing things on their legs, and then they're wondering, gee, could these symptoms that I'm experiencing potentially be from what I'm seeing on my legs?
If you have large or bulging veins on your legs, or you are experiencing pain, tiredness, and fatigue, or you suffer from restless leg syndrome, contact the New Jersey Vein and Vascular Center today and schedule a consultation.